Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to prevent vial coring. So what is vial coring? Well, this can occur whenever you use a needle to pierce a vial that has a rubber stopper. And what can happen is whenever that needle enters into that rubber stopper, pieces of that rubber stopper can enter into the contents of the vial. So whenever you go to withdraw the medication, pieces of that rubber stopper can actually enter into the syringe and potentially be injected into the patient. And the thing about coring is that some of those rubber stopper pieces can be so small that you may not be able to detect that with your eyes. Therefore, to help you really visualize this, think of how you use a core to remove the core from an apple. This is like a really exaggerated way to describe coring, but it's the same concept. So to help prevent coring of the rubber stopper with the needle, you'll want to perform the following technique. So first, of course, you want to do is perform hand hygiene. Then you want to prepare your vials. So if your vial has a top, just flip that top off and then take some alcohol prep and scrub the top of that vial stopper for about 30 seconds to just help disinfect it. And then whenever you've done that for 30 seconds, let it completely dry. After it is dried, you're going to take your syringe, and if you need to instill air in the syringe prior to withdrawing, let's say, medication from the vial, you can go ahead and instill air in your syringe. And I actually have a whole video where I cover step-by-step on how to withdraw medications from a vial if you'd like to watch that. So I've already put my air in, and then what I'm going to do is I'm going to remove the cap, and I'm going to hold the syringe at its barrel, and then I'm going to hold the vial with my other hand, my non-dominant hand, and just steady the vial. So what you want to do is you want to make sure that you have the bevel up of your needle. So the bevel is up facing you, and you want to find the bullseye design of your vial, and you're going to aim for the middle of that bullseye. So what I'm going to do, I have my bevel up, and I'm going to go at about a 45-degree angle, and I'm going to rest the needle there in the middle of the bullseye. Then apply light pressure to the needle tip, and as the needle begins to penetrate the stopper, push down while simultaneously rotating the needle to a 90-degree angle in one smooth motion. Then inject the air from the syringe into the vial's space of air. Okay, so that wraps up this video on how to prevent vial coring. And if you would like to watch more videos that demonstrate other types of nursing skills, you can access the link in the YouTube description below.